My name is Lawrence Lusaka and welcome. Let's start by painting a picture, image being able to look beneath the surface of someone's struggle and truly understand what's going on in their mind. That's exactly what psychological testing allows us to do. Today, we are going to explore two compelling case studies, Mr. J and Miss S, and see how tools like MMPI-3 helps to uncover their hidden challenges. This document isn't just about test results. It's about how the assessments guides diagnosis, shape ethical practice, and paves the way for effective treatment. By the end of this discussion, you'll see why these tools are indispensable in psychology. Let's begin with Mr. J, a 44-year-old man who was assessed after a serious suicidal attempt. His MMPI-3 results reveals a deeply troubling picture: severe depression, overwhelming hopelessness, and a complete loss of joy in life, what it was called melancholic feature. He felt worthless, withdrew from social interaction, and saw no future for himself. The test also raised a red flag about the potential overreporting, but this didn't diminish the reality of his pain. His case has a clear emergency, requiring immediate suicidal risk assessment and crisis intervention. Long term, he needed therapy like cognitive therapy and behavioral, and possible medication to help him regain hope. This case reminds us of how crucial it is to act swiftly when someone's life is in line. Now let's shift to Miss S, a 29-year-old student who came in struggling with focus and academic performance. At first glance, someone may have dismissed her as a lazy, unmotivated, but her psychological assessment told a different story. Testing shows that her cognitive ability were average, but anxiety was hijacking her attention and working memory. The MMPI-3 also reveals tendency towards personing and blaming others, common in people with chronic anxiety. And there was more. She had dyscalculia and math learning disability, which explains why numbers felt like a foreign language to her. Strategies to manage her attention include treatment plan includes CBT for anxiety, accommodation like extra test time, and more strategies for her attention. This case is a perfect example of how testing can replace label with reality. None of this matter if the assessment weren't conducted ethically. Both cases adhere to strictly APA guidelines, informed consent, confidentiality, and careful checks for the biases. For Mr. J, the MMPI-3 validity scale helps to ensure his results weren't skewed by overreporting. For Ms. S, the clinician considered whether her symptom may reflect cultural expression of distress rather than just text anxiety. Ethical testing isn't just about following rules. It's about protecting the dignity of accuracy of each person. So why use MMPI-3? Think of it as a gold standard in personality assessment. It's being refined over decades with updates normal to reflect today's diverse personality. Better validity scales to catch exaggerated response and sharper clinical scale to distinguish between disorders like depression and anxiety. But it's not foolproof. Cultural difference can still affect the results, which is why skilled clinicians are essential to interpret the results and the data. The MMPI-3 doesn't replace human judgment, it enhances the human judgment. To get an even clear picture, additional tests were recommended for Mr. J. The Beck Depression Inventory 2 will track his depression severity over a period of time, acting like a mood Fitbit to alert clinicians to dangerous dips. For Ms. S, the Conners Continual Performance Test will rule out ADHD by testing her attention under pressure. These tools act as layers of pressure, ensuring that diagnosis and treatments are as targeted as possible. At the end of the day, psychological testing isn't just about score and charts. It's about giving people a way out of their suffering. For Mr. J, it was the difference between life and death. For Ms. S, it's replacing frustration with understanding. Whether you are a clinician, a student, or someone who's just curious about psychology, remember this: behind every test result is a person who deserves to be seen, heard, and helped. That's the real power of those tools. Thank you for listening to me. See you next time. Thank you.